Welcome back to Focus on the Community. I'm your host, Minister HD. Today's segment is a community informational spotlight. And today we're focusing on screening increases the chances of preventing colorectal cancer. And March is Colorectal Cancer Awareness Month. Now, according to the American Cancer Society, colorectal cancer is the third most common cancer diagnosed in both men and women, and the second leading cause of cancer death in the United States, and that's including skin cancer. Now, colorectal cancer is a cancer that starts in the colon or the rectum, and there it will be an estimated 101,420 new cases of colon cancer and 44,180 cases of rectal cancer diagnosed in the U.S. in 2019. Now, who better to bring us in the loop than my very special guest? And he is the professor of medicine and the medical director of quality for the Northwestern Medicine Digestive Health Center, and that is none other than Dr. Kuswini. Good morning, doctor.
Hi, how are you? Thank you so much for having me, and thanks for that important introduction about the importance of colon cancer prevention.
Yes, and I think this one has affected us all somewhere, somehow. So with that, March is Colorectal Cancer Awareness Month. What should our listeners know about the symptoms and risk factors associated with this disease?
I think the most important thing that we can tell your listeners is that everyone is at risk for colorectal cancer. As you mentioned, about 150,000 cases a year are going to be diagnosed. And so it's not just people who have a family history. It's certainly not wanting to be limited to people who have symptoms, but all of us need to be thinking about how we can prevent colorectal cancer. In fact, that's why we recommend screening at age 45 in African Americans and 50 in other patients, for all patients to prevent colon cancer, because we're all at risk. That said, if we have a family history of colorectal cancer, or we're having symptoms that make us concerned, such as blood in the stool, we may be talking about doing a colonoscopy at an earlier age.
Right, so screening is detrimental. It's something we all need to do, and in some cases, such as myself as an African-American male, at 45, I should begin that screening as well as considering colonoscopy.
Right, so there's two main ways to get screened. Again, you emphasize this, and I want to reemphasize it, is no matter whether or not you're having symptoms or not, we want to get screened at age 45 in African Americans. And the two main ways are either a colonoscopy, which is that camera test that looks through the colon and removes polyps before they turn into cancer. So colonoscopy is the best way to prevent colon cancer. And then there's also stool tests that you can get, which is a good way to detect early colon cancer and some colon polyps. In a patient who's willing to undergo either test, I generally recommend that colonoscopy is the best way we have to prevent colorectal cancer at this point. But some patients aren't willing to get a colonoscopy and they do stool testing. As physicians and as advocates for the community, our best thing is to tell people, no matter what you do, find some way to get screened.
Exactly, I agree. Now, what signs and symptoms of colorectal cancer should prompt our listeners to see a doctor?
Great question. If you've already had a colonoscopy or you haven't had a colonoscopy, you still need to be aware of symptoms that may suggest you need additional attention. And that would be things like you're changing your bowels, if you're having a significant change in bowel habits over time, blood in stool, anemia or low red blood cell counts, a pain in your stomach that is frequent. These can be generally nothing to be concerned about, but they do want to prompt us to talk to our primary care provider or our gastroenterologist and say, should I be getting some additional testing now, given these changes in the stools? And I think the most important thing you can do is keep on top of your health in general anything that feels different to you is always a reason to just reach out to your doctor and say, is there anything else I should be doing?
Now, Dr. Keswani, if I'm getting a colonoscopy, what questions should I ask my physician so that I know that I'm getting the highest quality colonoscopy?
That's a great question. It's important to understand that not all colonoscopies are created equal. They are dependent on the person who's performing the colonoscopy. And as someone who's significantly interested in the quality of medical care, I think it's important for the patients to advocate and ask the right questions of their providers. One of the questions that I encourage patients to ask is, ask their doctor, how often do you find these precancerous polyps when you do a colonoscopy? Your doctor should be finding them at least 25% of the time if they're doing a good exam. And if your doctor doesn't know, to me that often reflects a lack of commitment to high quality colonoscopy. Also ensuring that you get a complete colon exam. How often are you getting to the end of the colon and looking for polyps is important as well. On the flip side, I think it's important for patients to ensure that they are doing what they can to get a high quality colonoscopy, which is specifically adhering to the bowel preparation that's recommended to them and a diet that's recommended before the colonoscopy, because that really does impact the quality of the exam that we can perform as gastroenterologists.
Doctor, what treatment options exist for people with colorectal cancer?
Yeah, although our biggest goal is to prevent colon cancer, sometimes we'll catch colon cancer at an early or advanced stage. It's important to understand that's not a death sentence. We can actually treat colon cancer and cure colon cancer through a combination of surgery, in some cases chemotherapy, and in some cases sort of minimally invasive treatments that can be performed by our radiology colleagues. And so you really want to be treated in a center that has what we call multidisciplinary care. It's not just one person managing your care. It's a team of doctors and nurses and clinicians that are trying to find the best treatment options for you.
Dr. Keswani, can you tell us where we can go for more information?
So I always encourage people to always establish with a good primary care provider and talk to them about any new options, but we also have a lot of information for patients on preventing and treating colon cancer at dhc.nm.org.
Awesome. Dr. Keswani, we truly appreciate you advocating on our behalf in regards to Colorectal Cancer Awareness Month. Keep doing what you do, sir.
No, and thank you so much for bringing attention to this. You have a good day.
And you heard it here on The Morning Chef.